Well, welcome to another Cutting Edge Show. I'm Omar Neal. I'm one of the hosts of this wonderful program. And of course, I'm the former mayor of Tuskegee, Alabama, and host of the You Got the Power radio talk show. Let me tell you, I am so excited about today. The University of Maryland School of Public Health brings this wonderful program to you each and every Thursday evening. And this is a Women's Month. And so we're going to talk about women history and how women have made significant contributions to the evolution of humanity in many, many, many ways. We are so excited to have a tremendous panel of guests today as we delve into a really, really important issue. Don't forget to be a part of this program in the multiple ways by which we broadcast: Facebook, YouTube, Instagram, and Twitter. Make sure that you like, share, and subscribe. And you can check us out with the CR code and sign up to be a part of our newsletter and to get information about what we are doing here on the Cutting Edge Show. You know, this show has been going on now for, it has evolved, but about 3 years now we've been doing this. And I've been doing it with a person to whom I call a dear, dear friend, in fact, closer than a friend or brother, my co-host, none other than Dr. Stephen B. Thomas. We call him Dr. T in this parts of the country. Hey man, what's going on? How you doing, Dr. T? You need to unmute. Now, this is the first time you've been muted in your life. So
I say, hey, Mr. Bear, it's wonderful to be here with you. I'm on a new machine, updated my machine. I hope it's working all right.
It's working fine. What
an amazing moment we're in right now as the pandemic continues and a war is going on.
Yeah.
And the newspapers have moved away from the kind of coverage we've been getting. I don't want people to think it's over.
Yeah.
And there are things that we can do right now, even in this moment, as the surge has rescinded, to get prepared for the next wave. That's what public health is all about, Omar, keeping people healthy before they get sick, not waiting and rushing in when they get sick. Let's get that message across loud and clear. Tonight, we're talking about celebrating women. We both have mothers.
Absolutely.
And I had the opportunity to meet your mom and spend time with her when she was here with us.
Mm-hmm.
And so what an opportunity to celebrate the women. And tonight we're going to be talking about issues around infant mortality, maternal mortality, how to keep our mothers and babies alive.
Yeah. Yeah, this is a powerful, powerful show. And you know, the other thing is too, Dr. T, you know, I caution people about, because, you know, we started out talking about COVID-19 and there's the Omicron variant is now emerging out of Europe now, that they say that there's another subset, if you will, of the Omicron variant. And I don't want us to spike the ball too soon. I do know that people are relaxing the public health mitigation measures around the country. And, you know, I do know people are tired and yes, they want to get back to some sense of normalcy, but I don't want people to just completely relax and let your guard down. The other thing too, Dr. T, and before we move any further, you know, I told you we need to come up with a program, say, how to boost the booster. we need to boost the booster program, right? Because we have, in Europe, they have 81% of the people who have been vaccinated have also gotten their booster shot.
That's right.
Well, we're like 60% in this country. So we are lagging in terms of the people who've gotten booster. We do know that the booster shot further protect you, at least give you a better cushion from the virus. So we need to do something about that. We need to really start another campaign talking about let's boost the booster.
Let me mention something to you that is breaking news on this show when we had Dr. Michael Osterholm on. And one of the points that he made was we're learning along the way. It could be that the normal course of being fully vaccinated is a 3-shot.
Right.
Rather than
Right.
calling the third one a booster, it's just part of the normal regimen. And maybe that's how we come back to let people know that we're learning and that third shot is part of the normal regimen. So CDC may be revising, what does it mean to be fully vaccinated? Let's keep an eye on that.
Yeah. And then you made a salient point before worth restating, is that we may have what we call an endemic situation here, where we may have to just live with COVID and learn to, like we do the flu and other things. We just may have to learn to live with it now. We don't know that, but obviously that's something to consider.
Well, let's help our people live with it, because it means that we need to talk about respiratory protection and not just masks. All masks are not equal. We've done it on this show, KN95 masks. And Mr. Mayor, the question is this: who are you sharing air with? When you walk in that restaurant, when you walk in that Starbucks, when you walk into a family home, how might we help people have the right kind of air filters in their homes that will literally take COVID out of the air? Amazing.
Wow. Yeah. Well, obviously that's something we need to talk about. And we realize that many places like schools are not all equal in terms of their air filtration apparatuses. So we probably need to talk about how do we upgrade, particularly those areas where we have public spaces where our children and other people spend a lot of time.
Absolutely.
Yeah. So we got a lot of work to do, but man, we could talk about that later. I don't want to talk about that now. I want to talk with some folk, man. We got, but before we do any of that, let me tell you this. This the scene. This the team behind the scene.
There you
right?
go.
Right. These are the people who literally make what we do work. You know, our head person, Meg Jordan. She's our tech director, and she's assisted by Maggie Daly. Saraya Khan, who is our social media and communications guru, and Kimberly Fleming's social media and media curator, and of course, the sound man, sound design, Elijah Pugh Jr., all make up the behind the scene team. And I like that behind the scene team. That's what, you know.
And I love the beat, Mr. Mayor. I love,
you know, that you see it's kind of flows, you know, because, you know, it flows off of the tongue. Man, do you know, I'm so excited about this show. I'm so excited about not just the topic. I mean, women.
Yes.
More than that, in an in-depth dialogue on the multi-dimensionary nature of women, and women are multidimensional.
That's right.
And we need to talk about that. You know, that's important. Some women are not just that; they're more than that. Whatever you think it is, they're more than that, right? And that was the thoughts about that. So we'll talk about womanhood, and of course, we're going to focus on maternal health and all of that today. We got a tremendous lineup. Dr. Francesca Weeks, who is just a stalwart here on the Cutting Edge Show. She's been with us for I think started out. She's been with us a long time. And so we're so appreciative to always have Dr. Weeks hang out with us. We got some new friends, and beyond friends, we got some new family hanging out with us. Dr. Stacy Little is going to be hanging out with us and you know, having this conversation. And of course, Dr. Marie Toma, who will be joining us as well. Let's bring up Dr. Weeks first and see what's going on in her world. Dr. Francesca Weeks. Hey, how are you doing, Dr. Weeks?
I'm doing well. Thank you guys for having me tonight. I always like coming on and talking to you all.
I want to say something, Mr. Mayor, as you see her photo, and for the audience to see her bio there. Francesca Weeks, Dr. Weeks, is just a classy woman willing to get mud on her boots, Omar.
Yeah.
She is in the city in Baltimore working with us in the barbershops and the beauty salons and helping to navigate our relationship with the city and county health departments. And we're just so glad to have you here, Dr. Weeks, to give us an idea of what you're hearing and what you're seeing from the front lines of this battle.
Yeah.
Well, I will say we're just getting started. It's going to be in Baltimore City right now. We're still behind. We're very behind. We're nowhere near close, our 80% in our African-American population. I wouldn't say nowhere near close. We're about 63% right now fully vaccinated in our African-American population. We just had a meeting this morning, a canvassing meeting. So we have the NAACP, Greater Baltimore Urban League, No Boundaries Coalition. We brought together at least 15 Black organizations. And we have a hardcore canvassing plan to go out and talk to everybody in the city by the end of June. So we have a huge task on our hand. But one thing we're just looking at is making sure people just have the correct information. We know there's 1,000 myths out there. And so right now we actually are being the myth busters. It's funny, our little coalition has kind of given themselves some nicknames of being myth busters because that's what we're really doing. We're going out, talking to people, but through this all, I think the greatest thing is we've built some really good relationships. There's disconnect that we saw before COVID between the community and even some of our agencies or organizations. We built some amazing relationships. So I think that's our biggest plus right now. Despite the fact that everybody's not vaccinated, the relationship and the trust has been built. And that's what I think I love the most about this process.
Yeah.
Mayor,
go ahead.
There was something you said, Mr. Mayor, about changing the metric, or at least adjusting the metric for what counts as success.
Right.
It's not just the needles and arms. What Dr. Reeks is describing is the relationship building. That's just as important as needles and arms. And more recently, Dr. Weeks, are we able to help those barbershops and beauty salons have the right respiratory protection and the right testing?
Yeah, so we're launching a program in Baltimore City where we're giving out test kits and we're giving out masks. Our lowest population right now we're seeing are African-American men, but mostly our young men. And so we're launching our program in our barbershops as well as we're looking at other places. I don't know if you guys have ever come to Baltimore, but we have the amazing group called Squeegee Boys that if you're at a corner, they're going to wash your window for you for $1 or $2. But we brought them into a program where while they're out in the communities, while they're out washing windows, they're also going to be giving out test kits, giving out information to people in their cars. So as much as possible, we're trying to engage our community where they're at, meet them where they're at, and listen to them and be active in the community with them.
That's what you call invisible capital, there, Dr. Dr. T. I mean, that's putting it where the cows can get it. I mean, that's important, man. You know, we have to look at every opportunity to reach people, and we need to think out of the box. In fact, I don't even like the box. I'm gonna throw the box away. Right. Let's just go and reach people where they are. What I am excited about, Dr. Weeks, is that you all have not stopped working.
Right.
Right. I think sometimes we can, when people say, everything's okay, it's good to come out now. And then you have unprotected people coming out as if they're protected. And then they are the most vulnerable. And so we need to make sure that we keep focused on those individuals as well, to make sure that they know that the vaccine is the best thing that you can do to keep yourself safe, right? And then mitigation measures also assist, but the best thing is the vaccine. Let's make sure we do that. Right. And we also need to promote our protection. If we've been vaccinated, tell people you've been vaccinated.
Yes.
That's something we got to do more of, right? Right.
No more closeted. No more being closeted and vaccinated.
You're right. That's good. What are you saying, Dr. Weeks?
I said, we have to believe in the science. We had a whole conversation. We had a huge group of people the other day we were talking to, and somebody said to us, well, they said, y'all that have been vaccinated and boosted, y'all are the guinea pigs. You guys are the science experiments. I said, no, it's going to come to the point where people who aren't vaccinated are going to be the science. You guys are going to be the test trial to see what happens over the next 5 years. So I said, we really have to trust the science and see from based on science, the best recommendation right now is vaccinations. It is masking up. It is still social distancing. That is the science, and we're going to stick with the science.
Yeah, I trust the science. I'm telling you, I'm vaccinated 3 times, and if they need 4, put me in line. That's what I want you to know. All
And
right.
we're going to adjust some of that language too, Dr.
Right.
Weeks, because now all masks are not equal. So we'll say respiratory protection and know your status. That's what rapid tests enable you to do.
Yeah.
Before you
Well, I'm
go
so excited. I'm so excited about what you all are doing, Dr. Weeks. That's off the chain. Give them some snaps, right?
Absolutely.
I mean, absolutely. That's wonderful. Good. Well, let's bring up Dr. Little. I mean, you know, Dr. Little is hanging out with us. Now, I just met her, but it's like you always known Dr. Little. I mean, she comes across as such an authentic person. Dr. T, would you please introduce Dr. Little?
Well, let me just say that for so many of the folks in the Hollywood Squares that we've had over the past 2 years, I've never met in person, but I have met Dr. Little in person. We were doing work together in health disparities before the pandemic, and that's why this is so important today. As you can see there with her bio in the audience, she's the Vice President, Population Health and Community Health, and leads the business strategy and development of women's services. And we have a brand new hospital called Capital Region Health here that she's part of. And she's been instrumental in helping us bring clinical services into the Barbershop Beauty Salon Network. Let's give some snaps for Dr.
Absolutely.
Little.
Hey.
Welcome, Dr. Little. You're muted.
Thank you for the invite. I'm happy to be here and be a part of the conversation. Absolutely.
Absolutely. Now you're new to the family, so tell people a little bit about yourself as you present yourself.
So in my role here at University of Maryland Capital Region Medical Center, I lead the community mobile vaccination and immunization efforts of this system. And I can tell you that what has really allowed us to penetrate the community in areas where perhaps there isn't a lot of health resources, or individuals who may have, you know, not been that excited about getting a vaccine, has been our partnerships, quite frankly. We have really leaned in on our partners, our authentic partners, not partners we created because of the pandemic, but partners that we literally had and have trusted and cultivated and continue to grow the relationships that we had with the.
You just muted yourself.
Sorry.
There you
Okay,
go.
go ahead.
I guess I'm moving around too much. But what that has allowed us to do is one of our sites, we've had a site now, a community vaccination site, where we have been able to couple flu as well as vaccine. We do boosts there. We've been there for over a year. So when we're talking about long-term, consistent partnerships for the betterment of community, we have had relationships with churches and with colleges, with centers, community centers throughout the county. And it's through these relationships that we're able to really reach community members who may feel like they haven't really truly been a part of the conversation, or they haven't been included in the educational efforts to really draw the community in, to know more, to debunk the myths, to really write the theories that help to fuel their desire not to get tested. Because we do have histories in this country that make people skeptical, and we have to own that. We have to own our responsibility is in the healthcare system, and what that means to members who are afraid to come in a healthcare system to get a vaccine, and really help them to be more of a partner with us and less of just a person in the community that we're trying to get to take a vaccine. You know, It requires conversation. It requires you wanting to be in that community and establishing relationships with people who matter, because everybody in that community matters.
Right.
And how do you get entree? Not by just showing up one day with needles. I can tell you that.
Right. You make your friends before you need them,
Right.
Dr. Little.
Hey,
Better have his friends.
Mr. Mayor, I want Dr. Little to know that there's an entire cadre of barbers and stylists listening to you, and some of your medical colleagues wondering how you do this. Can you say something to them about it's okay, it works, it's all right to get out of the hospital and get into the community, and
Right.
how these barber poles can help them?
Right. I can tell, so population health and community health is not a desk job.
Hmm.
It requires you to leave the brick and mortar of the white walls of an institution and really, kind of lock arms with community and begin to understand what are the needs, what are the concerns, what are the challenges. Let's talk about these barriers. Let's figure out how to overcome these barriers together as a collective, because it's not one entity's problem, it's our community's problem. So, and I'm a firm believer that particularly Prince George's County, that is flush with human resources and capital, human capital, intelligence and capacity, that we can problem solve and consider the solutions that we need to improve the health and wellness of our county residents. And we have the ingredients. So but you have to be willing to sit and listen and to work with community directly. And you can't do it from a cell phone. You can't do it from your phone at your desk, and you certainly can't do it from email correspondence.
Well, I'm telling you, you have hit on all of the salient points, Dr. Little, and we are so appreciative that people like you are in those spaces, right? So maybe you can transfer that information to your colleagues so that they know that this kind of distant connection is not effective in terms of really critical mass that we need to address such a pandemic. So thank you so much for being here with me. We got with us. We got a whole lot of conversation to have in the next hour and a half. Let's bring up Dr. Marie Toma. Dr. Toma is the assistant professor of Department of Family Science and School of Public Health at the University of Maryland. Dr. T, you want to say a little bit about Dr. Toma?
Well, she's a Terp, and I got to brag on her because Dr. Toma took her passion as a young assistant professor and jumped out and locked arms with the community, Dr. Little, locked arms with the community, and that takes time. And I'm going to let her tell you a little bit more about herself that's not in this bio, but I want to say, because there's young scholars out there listening, that Dr. Toma, let's bring her up on the stage, that Dr. Toma got some good news today. She has been promoted to associate professor with tenure.
Let's give us some snaps.
And she did that working in the community.
That's what we say. Merry Christmas. Hey, Dr. Toma, how you doing?
Thank you. Well, it's been a big day, so
this is
Dr.
wonderful.
Thomas, yeah, and I'm so happy to be here. Also a first timer, so great to meet everyone and be part of the family.
Absolutely.
Hey, Dr. Toma, tell this audience a little bit about yourself. That's not in the bio. Tell them who you are, why you do what you do.
I guess, and I'll talk a lot. So much of my work focuses on maternal health because I really feel like if we support the moms in the family, then the whole family's supported. And we know it's so linked to infant health as well. So by supporting moms and we can support the family more broadly. I come from a family of strong women as well. And so that's always what drives me. And a lot of the work I do is around really creating awareness of, just in general of the disparities that we are seeing around maternal mortality. I've worked with local, state, and national partners to shape policy and programs to really invest in maternal health, invest in health equity, and create solutions and think of innovative models of care in which to really support. Really, it's all about women, supporting women's health more broadly. So a lot of it is around creating awareness of some of these stark disparities we see in maternal mortality. And I think, you know, when you were talking earlier about COVID, there was a lot of efforts because we found that maternal mortality is so much higher in the US than in other comparable high-income countries. But then with COVID, they just released statistics that our maternal mortality was declining, COVID hit, and we've now seen increases in our maternal mortality. And
Wow.
There's some thought that the intersection of, you know, maybe directly with COVID, but also the pandemic itself, it left a lot of moms in that postpartum period very isolated. And so I think we need to be thinking about that and addressing some of those, the postpartum period is already a difficult time for a lot of moms. And I think it became more so during the pandemic.
You know, depression in and of itself is a part of having children, and then you add on the, you know, COVID, and that has to compound it. You know, one of the things, and we talked about it before, Dr. T, and I want to bring Dr. Ritter up as well. When we talked about the disparities in terms of African-American women and the challenges they have with childbirth relative to other demographics. Could you speak a little bit about that, Dr. Toma?
Yeah, so in a lot of what we're seeing, I mean, and it's probably been talked about on the show, but just in terms of the whole life course and the experience of racism and sexism and kind of diminishing of women's symptoms and their stories and their pain, I think contributes a lot to what we hear around the stories of maternal mortality. It's all related. Maternal mortality is kind of the tip of the iceberg, but it's so much of just finishing those experiences and then not treating accordingly. And it involves in delays in care and delays in quality care and receipt of quality care that we see so much with maternal mortality.
Go ahead, Dr. T.
What's the common name for mortality for the people out there who don't necessarily use that word? What's another word for mortality?
Death.
Thank you. We're talking about children dying, mothers dying.
Right.
You're saving lives, Dr. Toma.
Yeah.
And when you think about the barriers that you've overcome, I'm wondering if the folks who represent it with these barbers and stylists can be of help. And you're going to meet some of them later. They may know these moms before they get pregnant or right when they're pregnant and follow them throughout the course of their pregnancy and see them more than the OBGYN maybe.
Yeah, you're right. Go ahead, Dr. Toma.
Sorry, there's a huge campaign right now too. It's called Hear Her. It's by the CDC. Allison Felix, Olympian track runner, is part of that campaign and creating this awareness. That is definitely something within the community of creating awareness of these signs and symptoms so that women can seek care, can advocate for their care. And I will also bring up, it's hard to advocate sometimes for yourself. So there's creating just more awareness within the community so that you can be there for that person as well. In your life or while they're birthing, there's so many ways to help create that awareness within the communities we serve.
You made a salient point, Dr. Toma, and this is something that I think men need to really do some introspection work on, is how much do we advocate for women, right, in those spaces where we have influence. and we need to really do some self inspection and reflection on what we are doing. Dr. Cal Ritter, how are you doing? We came to your space. This is your playground.
I totally am. And I can't say comfortable in this space, but I totally understand the stress and the trauma of this space from decades of working in it. And from a personal point of view, my mother, when I was pregnant with my first, I asked my mother what, happened with her. I'm 1 of 10, by the way. I'm the 7 out of 10. So I was like, Mom, what happened? I'm the first girl in the family to have a baby. How was your labor? You don't want to hear that, she says. I'm like, yes, I do. No, you don't. Yes, you do. Anyway, turns out she told me after I had my precipitous birth that she had a precipitous birth, but they wouldn't let her they put her in a straitjacket. They didn't hear her when she said she had to push. They didn't hear her. So when you spoke about that Hear Her program, that's really why we have a problem here. We don't listen to women, no matter how much we talk. And the death, Dr. Thomas, death certificates have not put a box on for pregnancy consistently since 2018. So we haven't even collected the data to actually hear them. I've said that on this forum before, and it just bothers me because I've known about it for a long time. We haven't made a commitment to keep women alive. I went down to Cuba. They made a commitment to keep women alive. Pregnant women, they said it was when they died in childbirth and pregnancy, it was a failure of the system. So if it's a failure of the system and you put a commitment to it, they actually put a program in place, and for 5 years they had no maternal deaths. Now, of course, Cuba is Cuba and the United States is the United States, but the commitment is still real.
Well, what's so interesting for me, Dr. Ritter and Dr. T, you can say something afterwards. This is the richest country in the world. Why are we having these problems? That's what I don't understand. Can y'all help me out, Dr. Little?
Can I jump in?
Go jump in there, please.
So while we might be one of the richest countries in the world, we still struggle across this country with something called racism, which definitely fuels the way in which individuals receive care, unconscious bias that has been proven to affect the way in which providers care for patients can literally save a life. The way in which that physician, that advanced provider cares for this patient matters. And their biases drives the way in which they make decisions around care. And so we have to get at the crux of the matter. We can't keep talking around it. We got to talk right at it. And the issue is racism in America. There's also an issue of access, right? Because it matters where you are in the country, whether you have access to health care. Secondly, if you are poor and living in a low resource area and you don't have enough, you don't have a job that allows you to have health care, then you're reliant on whatever's available to you in your community. And if your community health center can't see you because they are overwhelmed with the number of patients whom they see on a monthly basis, so your prenatal visit is 3 months out, this is what happens. And so women come into care late. They don't get any care at all. They start off with their pregnancy quite oftentimes having chronic diseases. They develop chronic diseases during pregnancy because there's little discussion or real authentic work around preconception care and making sure that our women are as healthy as they can possibly be before they get pregnant. These all require a collaborative, multidisciplinary approach to healthcare, which we are trying to get there, but it is very much incremental. It's not a national approach. It is a state by state, county by county, very siloed and incremental process to change. So it is a huge multifaceted issue and problem that is fueled by so many things. But so I'll leave it there.
No, we're going to keep going. But Mr. Mayor, I wanted to, because Dr. Ritter is a regular with us, I want her to just remind folks what you do every day and where you do it. Dr. Ritter?
I'm a OBGYN, but I'm just doing gynecology now. I've been working in Baltimore for 30 years on maternal health.
And so she also brings to us the Maryland State Medical Society, and she's bringing these conversations back to them. We're trying to move the needle on so many different levels. So there's a fundamental question that came to me in a chat. Somebody's listening. Why would someone die in childbirth in 2022 in the 21st century?
That's true. It should
Women
be
dying in childbirth.
preventable. Yeah.
So what
That's
are the
true.
reasons? The floor is open.
So what we're saying is preventable. Let me say this because I want to get Dr. Weeks in this conversation. Dr. Little, you just laid it all out for me. So because if you don't, and people hear me say this all the time, if you don't understand racism, then anything else you think you understand will only serve to confuse you, right? So what we have here is, even in the state of Maryland, they have a new legislation that requires that all medical professionals, right, take implicit bias training, but they did not put racism in the legislation because of the, they said that was, what did they say? It was like being insightful. I mean, what did they say?
What's interesting is that it was in there and had to be pulled out to get it passed. Stacey, you might have some insight.
Tell us about that. Dr. Weeks, so do you know about what happened there?
Yeah, so they said it was because it wasn't inclusive of all women and making sure the safety and health and safety for all, that they would have to find different language to specify the racism part.
So,
you start some confusement.
That was their bottom line on it.
That I don't know what that I don't know what that means.
That unconscious bias, and then sometimes it's implicit bias, right? So it's not just race; it's the age of a young woman, the number of children that woman may have. It's their zip code. It's their partners who's coming at visits. It's the perceptions. It's the ethnicity. It's all of these things. So race is not all encompassing, and I don't want people to leave here thinking that it's just race, because it's not just race. It's just one of the many. It's like an onion.
Yeah.
When we try to pull back what are the drivers of women's health and the fact that we're still struggling in a Western society that has all of these resources, it's because the onion. So the onion it's very stinky, right? You peel the onion back, it's very stinky, it makes you cry. Racism is one of the things. Unconscious bias about a variety of things. Birthing people come in different ways. Being accepting and non-judgmental of that. Being prepared to address high-risk women and having the appropriate expertise and ability to address it throughout the pregnancy. And let me remind everyone, pregnancy is more than 3 trimesters. Pregnancy is 4, right? Because
help me out. Hold up. Don't just tell me that. Tell me what it is. I mean, don't just leave me like that. You leave me hanging, Dr. Little. Don't do that now. Don't do that.
It's just as important, because that's when that mom goes home with, the bruises and the beatings of having had a child and having to recuperate, whether it be it a C-section, be it a vaginal birth, maybe there was a tear, maybe there's depression. I'm not sure why I feel this way. All of these emotions and experiences, and quite frankly, the residual effects of having a child needs to be shepherded. Now, and historically, women lived in communities. Your mama, your grandmama, your great-grandmama, your aunties, your extended families and friends, people who weren't biologically attached to you, but they were people who helped you through your journey in life. We don't really have these communities anymore. I did a study here at this hospital about almost 4 years ago now around breastfeeding. And one of the major factors that was driving the lack of breastfeeding in women was the fact that they didn't have anybody in their sphere, of their circle of their family and friends, microcosm, who they actually knew who had breastfed ever.
Wow.
That's incredible. Well,
Right.
we know breastfeeding helps to improve the life trajectory of infants.
Wow.
So we have there's a lot of work to be done. So this
Well, obviously we know what needs to be done. My only concern is, why don't we just do it? I mean, Dr. Tolbert, you laid out, Dr. Little, you laid out, Dr. Weeks, you laid out what needs to be done. What's this resistance?
Well, I think some of it too is like our policies and structures don't support these time periods that we need to be focusing on the health of women, or, well, that's the whole time period, but around this postpartum care. And so when Dr. Little was talking, I'm thinking, we don't have paid, we're one of the few countries that doesn't have paid maternity leave. And so how do you create those systems of support when you might have to go back to work within a week of giving birth,
Right.
because you can't afford to be on unpaid leave? They recently, and they've been pushing, but it hasn't, not all states have adopted it, is with Medicaid policy and access to care. It initially, after 2 months of giving birth, if you didn't qualify for Medicaid under the normal rate, pregnant women qualify for Medicaid at a higher rate, so we can get them in covered under insurance. But 2 months after they give birth, they go back down to that lower rate, and then
Wow.
they're dropped from care. So you're just creating this system. We know that that postpartum period, like Dr. Little said, is so critical to maternal health. It's so critical to infant health, to so many things. And we're just saying, okay, you're done. You had a child, and now you're back on your own. We're not going to cover your care and health care and well-being that during this time. So I think things are changing. I will say that is positive. I'm seeing so many changes, particularly since a lot of, like what Dr. Ritter had said about the data not being available, but now it's starting to become available, and more awareness is being created to shift those policies. And so we are seeing some positive change, but the structures just aren't in place.
Well, what's so interesting to me, and I hear people say oftentimes, things are changing, they're getting better. Well, gradualism is a little bit more than do nothingism. People are dying, right? And we need to be more sensitive to that and more proactive and intentional about addressing those things through policy. I was a mayor of a city, county commissioner. I know policy is what drives those things, right? Right. So we need to do that. I'm getting riled up myself. So I want to feel like what our feeling is, our collective feeling. So what we're going to do is we're going to do the word cloud now. That's now that I'm feeling that now. We're going to do the word cloud. Dr. T, tell them about the word cloud.
So one of the things that we do is to get a pulse beat on how people are feeling out there in our Hollywood squares and out in the social media streaming audience. And so you can use the chat function here. Those of you on Facebook and on the other platforms, you can use the chat or the Q&A and just put a word in that best describes how you're feeling right now at this moment in the pandemic. And then for the next 60 seconds, put as many words in that come to mind. Don't overthink it, Dr. Toma. Just put those words in. Don't worry about spelling. And we have a crew behind the scenes that's going to build a word cloud. And we'll talk about what it tells us, how people are feeling right now and how we're going to move forward. We've done that over the past, Mr. Mayor, we have over 50 shows. And I think that the word cloud from the beginning over time will show us the ebb and flow of how this audience has moved across this pandemic.
Right. And it's interesting. The other thing is it shows our collective emotions and feelings. And so it kind of let us know how we are feeling, because the larger the word is, the more people said it.
That's
and
right.
so that's so and nobody knows what someone else says. So it's not like it's not a cheat sheet, right? So that's how that is. Okay. All right. So let's do this. Let me tell you something. I thought about this, and I think Dr. Thomas said something that really just spurred this thought, was that you teach a woman You teach a man, you teach an individual. You teach a woman, you teach a nation, right? Well, I'm going to paraphrase that. When you treat a woman right, you treat everybody right, right? And so I believe we need to be intentional about how we treat our women, because how we treat our women, our children come out to be more balanced and developed in terms of emotional and other things that make them whole people, right? But when we don't, then they are damaged. You can't make anything perfect out of an imperfect mold. So the more we can create a comfortable space for women, particularly while they are giving birth, the better emotionally balanced the children are. Is that hyperbolic, Dr. Little?
Well, when you were speaking, I was thinking about the importance of support during the pregnancy and postpartum period. And one of the things that I can say, Maryland, we're getting there, right? So we recently passed a legislation to extend Medicaid for 12 months postpartum. We need to have Medicaid coverage during the prenatal phase, but that's uphill. We're gonna get there. And then the other piece is the support of doulas, right? And so having, and people think about, okay, doulas is nothing new, right? So before Christ, women delivered each other's babies, okay? And women supported other women in delivery of children. And there were lay women who acted as midwives. Now, doulas are not midwives. They're not clinical. However, they're trained in oftentimes as lactation supporters, or they can assist with breastfeeding, they can assist with just knowledge around the gestational periods of life, what you're experiencing, how to support the partner and supporting the birthing mother, the birthing person. All of these things the doula helps to do. And I try to explain it to people like this. Your doctor's not available at Saturday night at 8:00, but your doula will be. The doula is available at Sunday. And after you came home from church and you feeling some kind of way and you want to talk to somebody who can help you understand what's happening to your body. That's what a doula is for. Let me support you in your journey of motherhood and delivery of this life. And that's what the doula does. And the doula should be doing it in collaboration with the physician or the advanced practitioner. It is a collaboration. It is a multidisciplinary approach to the care of the patient. And I think that we have a long way to go, guys.
Yeah.
But I'm so pleased that in Maryland, we are looking at how to compensate doulas through Medicaid, and hopefully it'll happen through private insurances so that women can not have to pay, because right now doula is a fee for service.
Well, it sounds like community to me. A doula sounds like just a community.
Very knowledgeable. Very knowledgeable.
Well, you call it what you want, Dr. Little, but it sounds like mama, auntie, and all them, and all them.
Very
auntie them.
Auntie and them is so knowledgeable that you need auntie and them on your show, on your team, and they are helping you through your journey. They also help around, just knowledge that a lot of people don't take advantage of a birthing class. Because for whatever reason, maybe you can't take off work, you don't have a partner, so you don't want to go because you feel like I don't want to go by myself, or whatever the reason is, right?
Is it made available to everybody? Because I'm thinking about rural communities, right? Where that may not be even available to them, right?
Yeah.
So I think we got to talk about that. Let me do this. I want to see what the word cloud. I'm really interested in seeing what this word cloud is going to look like. Let's put up the word cloud. Determined. Right. Look at that. Hopeful, tired, cautious, right? But those are the main thing. But if you notice, the largest word is determined and hopeful. Now that there's some people who are tired, and as Fannie Lou Hamer said, I'm sick and tired of being sick and tired. And so we understand people are that. You see supportive and nurture and listening and love and hope that it ends soon. I guess that's what it is. Then you got relentless advocacy, grateful, right, thankful. I mean, so we got a lot of great words, but I see determined. And when I think about women, that's what I think of: resilience and determination. That's what I think about with all of the women that have been in my life. That's what I see: strong women. And so I'm so appreciative of this day. I wanted to kind of, Dr. T, you can take it down now. Thank you. I wanted to kind of be a spectator in this show. I wanted the women just to just take this show, right? I ain't want to be the host. I just wanted to listen, right? That's how I felt, because I want to know. And I think sometimes men, we don't empathize enough. We can't really grasp what women go through. And so I don't think through that lack of understanding that we can shape policy, right, that speak to those specificities that are required to address those ills within the women community, right? And so we got to do a better job of that. So I want you to close your eyes and give me your crystal, look in your crystal ball, Dr. Weeks, and tell me, what should we be doing? What are we missing? What in this conversation, what are we missing? What do men miss? I want to be very specific. What are we missing?
That's a very loaded question. I don't think you want to ask women that.
You know what? You know this is hold up, Dr. Weeks, this is the cutting edge, right?
Oh, wow. So, I'm a policy guru, and you just said something very important on my head. I run policy coalitions around the country. Right now, if we look at our 50 states, our majority that are leading in our state legislators are white men over 50 who do not come out of their seats to talk to any women, who barely talk to women legislators, who barely ask them, what is it like for you as a woman legislator, as a mother, who won't have conversations with them, who will put in policies to block Planned Parenthood, any other services that women need. Right now, we have 14 states trying to put in abortion policies. And those abortion policies don't just impact abortion, they impact a ton of other services that help women, like Dr. Little said, access. 14 states are taking away access to women to be able to go to a doctor, get examined, get the medication they need, be able to even get a doula or a midwife or somebody to come in. They're blocking those services right now in 14 states. There's policies in that may be passed by the end of June this year. And if those policies are passed, if those abortion policies, all those policies, what's going to happen to those women? What are going to happen to those babies? And that's something serious, because we don't want to go back to the 60s where we're having women using different methods, wire hangers, other medications, to find methods to get rid of their child because they don't have the resources to take care of themselves or the child, or they're pregnant. We're not even talking about once the baby gets here. They will not have access to health care for those 10 months. So right now, what my biggest thing is, we need these men and legislators to realize they don't have to go through this pain for 10 months. They're not the ones who have to go through this healthcare system. We need men to listen. We need men to actually maybe even talk to their wives and ask them what it was like.
One of the things is this is a political issue because women are the largest voting bloc in this country, right? Well, we know that what get politicians to listen are constituents who vote, who engage in the process. Have women done a good enough job in correlating their vote to addressing these issues in a policy way? I mean, first step in any liberation process is that the oppressed must first withdraw their participation from their own degradation. Let me talk a little bit about that. Dr. Toma.
You got a crystal ball. All you have crystal balls.
I'm asking these hard questions now. Y'all family now, so now I'm going. We get knee deep in it now.
All right, this is so up my alley. I talk about this all the time. I think this is like the cross between politics and religion here, right? And this is, like I said, what women's health elects our politicians. But what Dr. Weeks was saying about abortion is a failure of a plan, right? We have plan B. We talk about plan B when it comes to the coronavirus vaccine. Well, we have plan B when your birth control fails, right? And in other countries, they have who have socialized healthcare systems. That process between a doctor and a patient is private because they can do it with a little pill, a very safe little pill, by the way, which I can tell you the science behind. It's like this, it's safer than aspirin. It's an anti-progesterone, but we can't get access to that in the United States because the politics has put a restriction on it as a dangerous drug. So our failures of contraception have to go from our private systems into a public system and go to a abortion center that have protesters there. So it's like 10, only 10% of our abortions here are with this little pill, where 90% in other countries are with this little pill. So it's a huge difference, and it's all because of the politics and science here. Yeah. So I think with part of the solution, when you want to break down the box, Mayor Neal,
yeah,
I think men should start coming to the gynecologist.
Hold up. Hold up. You
that would solve a lot of problems.
You have gone too far. You have gone too far. Now.
No. I think they can do it. They're coming to my office now to get the vaccine. I'm telling them, okay, you're going to get the vaccine here, but you got to put your feet up in the stirrups. And they're like, right, they turn white, right. And they go like,
right. I already know you. I love you, Dr. Ritter. Dr. Toma, this is hard. This is hard. It's a hard conversation because, one is we got to be honest, right? We got to be authentic in order to move and change and transform. There has to be a reckoning. There has to be an honest, authentic conversation. How do we really frame the issue? Because how you frame the issue determines who embraces the cause. Help me frame the issue where people can understand, the importance of changing the way we're doing things.
Not sure I have answers for that entirely, but I guess one thing that when Dr. Weeks was talking about abortion as well, and kind of going back to the 60s, I mean, the one thing I often communicate is that these will most definitely increase it. These changes in policies could potentially increase our maternal mortality rates, which we already know are so high. And when I think often the framing is thinking about, and I'm getting into maybe certain territory, but protecting the fetus, but then without any consideration for protecting the lives of women. So I think we need to be thinking more broadly about whose lives we're talking about. And I think in general, in terms of thinking about a policy shift, as I said, I do see it almost these contrasting things. There's so many policy initiatives going on, particularly to address disparities in maternal health through the Momnibus. But then there's also these reproductive health policies that are in direct contrast to any sort of progress we might make with some of these other initiatives. So we're at an interesting time. And yeah, I'm seeing in the chat here, yes, we need to be talking about birthing people more broadly too.
Yeah. Dr. Toma, you go ahead, Dr. Steve. What were you saying?
I just want the audience to know, and our guests to know that one of this part of this initiative operates in barbershops and beauty salons, and there's sacred spaces for these, for men and women. And what kind of conversations we could start there that could help men better understand how they can help the women in their lives, but women in general, how we can be better advocates for the policies and for the role that we could play as being more supportive. You have a platform here. Talk to us about what do we not know that we need to know so that we can be better as men, as partners.
Well, see, part of the, and let me agree with you. Part of the problem is that men, and I don't want, we're not monolithic. That's the first thing.
That's
So
right.
so let's not just say men generally, right? But I think there is this notion that somehow women are autonomous from men and, separate from men. Everybody got a mama, right? They got sisters, they got, aunts and cousins, and it's everybody, every man has some kind of woman in your life, right? Why don't you have the same kind of appreciation and advocacy for them once you know that these are specific needs that they need to be whole? That's what I don't understand. And Dr. Little, I want you to help me out here. And then I'm going to bring up Sandra. I want you to be ready to come up. And I don't want to be overly political, but it does appear to be a bit hypocritical that you talk about abortion and that, and then when the baby get here, you don't provide what they need during that time. Is that a bit hypocritical for you?
Are you referring to who's not?
I'm talking about
policymakers.
policymakers.
Well, I would say if policymakers were on, or if legislators were on this call, they would say they do. They would say they do through WIC. They would say they do through TANF. They would say they do through Head Start. They would say they do through, and the list can go on and on and on. So while there's a belief that that folks feel like children aren't, the problem is this is a very, very complex conversation that we're going down now, because it's also religiously driven,
right?
People's morals and values, and judgments. We're in a space now where male identified people who are born female, have babies, come to the hospital, and people don't know what to do with them. They don't have a clue. Like, oh my goodness. Okay. So these are some of the challenges, right? So we're getting more and more complex, but we don't have really the answers, I can tell you, in these systems to address all of these complexities, because health systems have been built to do the following: meet, greet, and treat. And what has forced the hand of health systems to change that model, quite frankly, was the Healthcare Act.
The Affordable Care Act?
Thank you. It escaped me just now. The Affordable Care Act, which forced the hands of hospitals and health systems to really begin to look at how you are utilizing some of the resources that you have as a system to improve the health and welfare of residents who live in, serve, and come to your hospital, right? So more and more, they were forced, but I think now it's been embraced. And so now it's how do we really truly utilize these resources to do a better job of not a meet, treat, and greet model, but a partner in health model.
Right.
How do we really engage and learn and understand, integrate, right? And train our fellows, our residents, our physicians to understand how to embrace difference and to still provide quality and safe care. Right. How do we do that realistically? Like, we can talk about it, but realistically, how do we do it?
That is a paradigm shift.
Very complex.
Little. That's a paradigm shift, right? That requires, as Dr.
Cultural shift, knowledge shift, willingness to be different shift.
Right. It is.
Just on a variety of levels. It requires a lot of shift.
Economic shift.
Let me thank you all for this authentic difficult conversation. And I know that sometimes it feels uncomfortable having these conversations. Many of you have jobs that are supported by, institutions that would like neutrality on certain political issues, and I understand that, and I'm sensitive to that. But during this time, and we're in the barbershop and in the hair salons, we kind of can give ourselves permission to at least explore the truth about whatever it is we're talking about. And that's what we do here on The Cutting Edge. Sandra Jenkins, bring her up, and let's see her. And hey, Miss Sandra Jenkins, how are you doing today?
I'm doing wonderful. I'm doing well, guys. Just really absorbing all this information tonight, and can very much relay to exactly what it is that we're discussing. I'd like to announce first that my name is Sandra Jenkins, as you all know already. I am a stylist in the state of Pennsylvania and the salon owner of Naturalists. We are right now developing the Wellness Warriors program into our salon that I must say it's a godsend. It is a godsend in relation to one of the topics that we're discussing tonight. It is something that can be just brought out where, we have clients who are interested as to what wellness warriors mean for them. And, where does this take the salon, chemistry and the atmosphere in general? But I must say that community is very essential in this whole gamut. Community, knowing your community, establishing a business in your community, building relationship with your public officials, things of that nature, instills more and more confidence in your operation of your salon. We have right now a wonderful gadget that we right now are experiencing, and that is the air purification. And that has been such an amazing piece of conversation. That is such a conversation piece. I was able to explain it more in detail today after our early day discussion that we had. This is so incredibly critical when you're discussing those types of things that will support and help people live healthier lives. In regards to, the issues that revolve around women and pregnancy. My clients who've known me for many, many years, have been in the industry for, I would say, nearly 40 years. They know about me, they know about my background and the type of person I am in regards to health. So they will confide in me, not just to beautify them, but also to really offer information in regards to their overall health. So that is all connected. And to help them and to support them throughout their gestational period is remarkable. Building those relationships with parent, child, and then you're building a relationship with another generation that's coming your way. So to have those generations in your salon is more of a unified effort and really understanding someone's health overall. And that's really maintaining the business. And that is such a wonderful experience to incorporate into your salon. So I must say thank you so very much for this program. And I would like to also add to that, the training that I'm right now just started with the Pennsylvania Southeastern Pennsylvania Health and it's Education Center. That is a wonderful, remarkable program. And I'm looking forward to becoming a community health worker along with my other colleagues, Michael Brown and Katrina Randolph. So wish me well. Thank you.
Let's
Mr.
give her some
Mayor,
snaps too.
give
Man.
her some
That's
snaps, indeed.
absolutely. So we're so proud of you, Sandra.
Indeed.
Really, we are.
Thank you.
You packed a lot in there, Sandra, and I want to back up just a little bit because the salons, Dr. Toma, Dr. Little, Dr. Ritter, are in the program are now centers of education. They're They're trusted information centers.
Mhm.
And what Sandra was talking about was that we were able to deliver to her shop a Corsi Rosenthal COVID filter that literally takes COVID out of the air. And it was designed and built by our students here. And maybe we have an image that we can show the audience. But the point is that when people come into the barbershop, these boxes have been decorated by middle school science students at a middle school, College Park Academy. And now they're a conversation piece in Sandra's salon. And once that conversation starts, that curiosity starts, it's an educational moment. I'm so glad that you're happy to have one of these boxes in your shop, Sandra.
Yes.
That's wonderful. Well, again, no pun intended, but we are thinking out of the box. All right. Okay. All right. Let's do this, because we oftentimes restate the problem, and I know that I have asked in different times, what do you think the solutions are? But I really want to get to some solutions. Let me see if I can do this too. I know that we have Mike Brown. We want to bring him in, and then Katrina Randolph. We need to bring you in, and then we need to go to Stacy with Rejuvenate to bring our folk in. Let's Mike. Let's bring Mike. Let's bring a brother in to see what he's thinking about all this, what he's hearing today.
Well, you ladies are phenomenal. It's just encouraging to be able to sit and listen, to be on the other end of the scope, and trying to get some feedback on what it takes to sustain your healthy marriage, because that's the mind frame you put me in. I'm with my wife all the time, and just listen for some pointers of how we can coexist at a high level. And I was just listening for you guys with some input of how to get it done. But if we were to bring this topic in the barbershop, I think we would get different answers, especially from the guys. I heard a lot of on this show. How can we be there for the women? Of course, we need to know that. I would hear in the barbershop that the women need to know how to be there for the men as well. I would also hear that the infrastructure, as far as the wealth for the family, the woman is the breadwinner now. And in our community, when the woman's the breadwinner, she has a little bit more authority than the guy, and there's a little off shift in the balance. So it's just a lot of things we could talk about. I don't want to take up all the time, but I just like to be open with what's going on.
Real talk, man. That's just real talk. Yeah, absolutely. And that's very important, because I think as we talk about women needing to understand, men needing to understand what women think, I think it's the reversal is necessary as well. Conversely, that's important to do that.
Dynamite, just say a little. We got an audience that don't know you. Tell them a little bit about what you do.
I'm a barber by trade. I'm also a certified community healthcare worker by the state of Maryland. Been with the hair program since 2010, from the fetus position to now, and be a part of watching it grow. It's just been an amazing journey.
Yeah. So see how he brought in the subject and contextualized it. You know?
Mr. Mayor, I want to put this out because I'm hearing Mike, and one of the things that we've heard when we tried to do our efforts around infant mortality and maternal health is that here's what we've heard. We've heard that many of the programs focus only on the woman, only on the child, and leave the men out. Even when they come into the facilities, they don't see themselves, they feel out of place. And so if you want the brothers to be part and be supportive, how might we help make the environments that you're bringing them into and the initiatives around infant mortality and maternal health speak to them as well, make them welcome as well?
That's a deep
That's
question.
rhetorical. It's the crystal ball question.
This is what I was saying, bring them into the gynecology
go ahead.
office and cover up the stirrups. Maybe they'll be more comfortable.
you got to go there, don't you, Dr. Ritter? I just
No, honestly,
just love it.
whenever the guys do come into my office, I make them comfortable and they do learn. And then I really, think that there is that connection is essential. I mean, not just from, the family unit, but from the political unit. We didn't have the understanding that women having childbirth and having to leave the hospital in less than 24 hours. Remember that was a while. And then it wasn't until a legislator's wife had to leave in 24 hours, the law was changed. So when it affects the man, then the law changes. So
Wow.
yeah, we need to get the men and the women talking.
We got to start. We got to keep this conversation going. Let's bring up Katrina.
Maybe we should create a group of men for women's health and men for infant health. And it's just an advocacy group of men who learn about women's health and learn about infants' health, and they become advocates.
Well, I agree. I think that's wonderful. I agree with that, Dr. Little. That's you don't, what they say, you done hit on something now.
I mean, we're gonna have to get Mike Brown and his friends and all these male community health workers and let them be a part of our effort and give us feedback. How do we make it more male friendly? Because quite frankly, when we develop these services for women in hospitals, we're not thinking about a man. You're absolutely right.
Right.
Think
Good.
about what is a woman's need. Now we do think about partners. We think about whoever the partner is, because we create rooms to have space for the birthing person and the partner. So that's true. Okay. But it's not gender specific for the partner. Whoever the partner is whoever the partner is. Or if it's your doula, or if it's your caretaker. We don't really, your caregiver. We don't really get into how do we make it more friendly specifically for particular groups. And I think this is a very valid issue, right? So when we're thinking about how we help people to be better parents, how to be better at caring for that infant, how to be better at supporting the birthing person, we're gonna have to help this person in that journey of being a better supporter of the person who just delivered a whole entire life.
Right.
Stop acting like it's something that we just do all the time, like, going in the kitchen and getting a box of cereal. No, this is the delivery of a human being that grew inside someone for almost 10 months. Let's stop acting like it's nothing. And I understand women, COVID histories, went into rice paddies, went onto fields, held onto a tree and had a baby. But thank goodness we have evolved from that.
Right.
And the reality is we need to do better.
Okay.
And then also
go ahead.
Suffered by going right into those back to work.
Right. We definitely had high maternal morbidity.
High maternal morbidity and mortality. And I would say you can be the advocate. I mean, you will be there if you, the birth partner, advocate for the mom. It's hard to advocate for yourself when you're in labor. Afterwards, you might notice, like, understanding those signs and symptoms of preeclampsia, that is one of the leading causes of maternal mortality, like recognizing that. There's so much.
Hold up, Dr. Toma, when you use words like that, Dr. Toma, you went over our head. So you want to you have to reel it back. Come on back and tell us what that means in other words. Okay.
So preeclampsia, well, I should let the obstetrician better probably define it, but it's in general, severe hypertension, please jump in here. And that's right. that also has, there are other signs, but there are like there are symptoms that can be very visible, like often like a high amount of swelling that can be indicative of some, potential complication during pregnancy or postpartum. And so those types of things, in the barbershops, if men.
You're making such a good point, Dr. Toma, because because we know if people with preeclampsia, it's like 1 or 2 days postpartum. That's a life or death. And if we
wait, slow down.
So postpartum depression, is all of that connected?
Not depression. I'm
Okay.
talking about
Pre-
hypertension. That's
Right.
what all
Okay.
it is. Hypertension during pregnancy, be it you had hypertension before you got pregnant. Now you have
Okay.
hypertension while you're pregnant, because hypertension
Okay.
doesn't go away. It's only going
Okay.
to get worse during pregnancy. Okay.
Okay.
So now, or you develop hypertension during pregnancy, right? We know that that patient has to be followed intensely by providers. And within that postpartum phase, like after that person delivers that baby, those first 3 days, not 6 weeks, because there's belief, I just need to get back to my doctor within 6 weeks. Within that 3 days of you leaving that hospital, everybody needs to have eyes on you. If you had hypertension during pregnancy.
Wow.
Yeah.
Because you run the risk of dying.
Yeah.
Wow. Wow. That's deep. That's you all have really hit on a salient point. Let me bring Katrina Randolph up, and we're going to continue this conversation. We got Dr. T, do you know we only have 10 minutes left? I mean,
What?
I can't believe it. You know? But
I
that's
don't believe
Dr. Weeks, or while I bring Dr.
Katrina's up.
You know, Katrina Randolph is the doctor of hair, short hair. She's the doctor of short hair. Go ahead.
And introduce yourself, Katrina.
Hello, everyone. My name is Katrina Randolph. I'm a certified community health worker through the state of Maryland. I also own Trey Shades Hair Studio in Capitol Heights. This is a great conversation for me tonight, and it was well needed because I was getting ready to ask the question about preeclampsia. I wanted to get some more information because I have a 30-year-old daughter that's expecting right now, and she's on bed rest in a hospital as we speak with preeclampsia. So I was getting ready to ask you guys some information in regards to that. And one thing that Dr. Little said that was very key, you have to be healthy prior to perceiving a child. So I just wanted to get a little more information, but I guess you all pretty much answered all of my questions in reference to preeclampsia. I did understand there was hypertension, but I wanted to know how is it developed? Is it something that can be prevented?
That's a good question, Katrina, because, they haven't done as much research on that as they should. They should have had a solution to this condition by now. It's elevated blood pressure and it's elevated platelets. So it increases clotting and you get all this fluid and your liver functions go off. And it's kind of like a silent thing and it doesn't, and it evades economics. So it happens to, the rich and the poor. So I think it really is unstudied. And a lot of it is because I think of racism, because it doesn't happen as much to white people as it does to Black people. But it's a silent killer, and it can happen from any time from the third trimester to postpartum. So it's a problem, and it's really unstudied. So we really need to put it in the barbershops and put it in the salons and get some research on it.
Definitely, because I know a lot of my clients come through with questions in regards to premature mortality, like they're losing babies more often than ever now. And I don't always have the answers for them. So when Dr. T told me that was going to be part of the conversation tonight, I was a little excited because I wanted to learn more about it. I started doing my research this week just for my daughter because she had called me and said, well, Mom, do you think it's because I got the vaccine? I said, I don't think so. I said, but we're going to do some research just to find out, if that's one of the side effects, but I don't believe it is.
Wow,
No,
that's a good question. Yeah, go ahead, Dr. T.
Mr. Mayor, because I think Katrina just exemplified why they are such powerful communicators. She didn't say no. She didn't just blow their daughter off about the relationship with the COVID. She says, let's do some research. And I'm back to you. Then she comes in here tonight with all these experts, and brings the case to us. She can go back with confidence and talk to her daughter, and then go back with confidence and talk to any other mom who comes into her shop. That's what our wellness warriors do. Thank you, Katrina.
Good.
Thank you all for sharing this great information with me.
Hey,
I'm gonna make sure my daughter listens to the recording when we're done.
Absolutely. We love you, Katrina Randolph. You know that.
Likewise.
Incredible. Absolutely. Good. Let's bring Stacy Ruffin up, and we're right at 5 minutes.
All right. I just want to say hello to everyone, but I really this topic has been in my life since I was 13 and I just turned 57. And I'm going on the darker side of abortions. I used to go around talking to people because I was raped at 13 and had an abortion, which my dad had to raise us. And just speaking of, like, I still remember at 57, a lady came in and said that I was going to go to hell. I'm 13. It said I was going to go to hell if I had this abortion. So I remember that same thing about my dad, being a single parent and a 13-year-old, they're having an abortion. And I didn't even have to have abortion because when we went to the Planned Parenthood, I actually miscarried as we were going there. And it was because of like a lot of things. I held it for so long. I actually miscarried before I got the abortion. And they told me, I went to a doctor, and these are so many kids are misleaded about abortions because, like I said, I'm 57. I actually had a baby 7 months later, well, 6 months later, after the miscarriage, which was leading to an abortion. But I used to go around the high schools as a teenage mother talking about abortions. I had an abortion in my 20 years old and got my tubes tied at 21. But they don't talk about the after effects about abortions. I'm not against abortions because I think if I was 13 and was raped, I think that's important to talk about. But the dark side is I'm 57 and I still remember having abortion, but I think it still was the best choice for me at 20 because I had a lot going on. But these are things I think they need more people that experience that's still making it. I just had one child and that was at 14, but the experience is the aftermath. Am I still going to hell? I still remember at 13 the lady coming in, she was a nurse. I'm telling me I'm going to hell. So it's so many people that's in the nursing industry that people don't realize when you're on a table and going to these appointments that they're like anti-abortion people, and these are so many people hearing this. I'm 57 and I was 20 when I had an abortion, and still remember the same ruthless person when I was 13 was in there again at 20. So we have to really see, are these people still in there? They're fighting about not having abortion, but I'm concerned about, and I'm still traumatized of who's in there actually working in some of these centers. They are really giving a lot of people that's having it a bad rep. You see them outside, but they're actually inside of these operating rooms and these nursing places. So we need to talk about that, and like I say, I used to go around high school talking about teenage pregnancy, but at 20, I needed to talk about an abortion because like years later, it's not easy. Just, knowing I'm a Christian and still, people say, if you have it, I still hear it. If you have it, you're going to hell. I'm still thinking, am I going to hell at 57? Even though I know God ain't going to send me to hell. But I didn't want to make it dark to y'all. But this is a topic that means a lot to me because I like to talk to any of my clients that come in here. I don't tell them to have it, but I don't tell them not to have it. So I'm just in a fence. I'm traumatized, but I'm also relieved I only have one child. Yeah. So, but it's like, it's a topic that will go for the rest of my life. So, I mean, there's a lot of good, things, but I think we need to really, and the doctors, we really need to talk about some of the people that's against abortion. They're in there with these people that's having these abortions. And it's really sad. It's really sad because they don't understand. We got to live with that for the rest of our life anyway. But they're inside of these doctors' offices. So I don't want to take up no more time, but I'm from Philadelphia.
Go ahead.
Let me
Go ahead.
thank you. Let me thank you. Snap for her. We've got a sacred space here in this virtual space. You come to share
Absolutely.
that story.
Absolutely.
And we talk about microaggressions. This is a form of aggression when someone's vulnerable in that situation and to impose your value on them and make them feel guilty. That's the other theme here. No shame, no guilt when you come into our hair network, barbershops and salons.
Yeah.
Very
Yeah.
important.
Hey, Dr. T, time is up.
I can't
Precious
believe
of
what
life.
a gift we've had tonight.
Absolutely. Let me start by thanking each of you. Dr. Weeks, as always, you are an integral part of who we are and what we do. You are really incredible. Thank you so much for sharing today. And we're going to work on public policy and getting people engaged and getting them informed about what really matters. Thank you so much. Dr. Toma, you are an incredible person. Thank you so much for being here with us. You just fit right in. Let's give her some snaps. You just fit just right in, and just as if you were here the whole time. And in fact, I want you to know that you have an open invitation to be a part of the Cutting Edge show. So much love to you. All right. Dr. Stacy Little, man, the way you bring it, I say you put it where the cows can get it. I mean, thank you so much for your authenticity and your honesty, and just putting it in layman's terms where people can understand exactly what you're saying. We really appreciate your being here today. Dr. Ritter, as always, we brought it into your space. So we so happy that we had our Dr. Ritter to be here to
Can
really
I just mention my background that is in behind me for the whole time I'm here is the most powerful community of women that we know, the Maasai women, and their greeting. If we can get to this greeting in our life, we will be better. And how are the children? And are the children well?
Good.
That is what we need to do in this community.
Good.
To bring us together.
Thank you so much, Dr. Ritter. Miss Sandra Jenkins, as always, such a beautiful spirit. And Stacy, thank you so much for sharing your story with us. We love you so much, and you have family here who embrace you. So you know that, right? We can't forget Dynamite Mike Brown, right? So who brought the male perspective in. We want this to be a woman's show, and we want it to be women-centered, and we were intentional about that. We don't apologize for the fact that we do need to narrow down subjects and not be so broad that we don't get to solutions. Dr. T, I love you, man. Thank you so much for helping us being the glue that keeps us together. Thank you so much. To our team behind the scene. Thank you all for everybody who do everything. And for those of you who I may not have mentioned, do know I love you as well. As always, with the time being 2 minutes after, as always, I like to leave you with these 2 words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Until next week, we'll see you on the Cutting Edge. Have a wonderful day. Bye-bye.
All right. Bye-bye. Be